it's important to say that scientists all over the world are really doing their best to try, but everything is experimental. Yeah, and that is why even for us, it is very important for our clinicians to come together and say, what are we going to do as Kenya? Yeah, so I think everyone is trying something elsewhere. Initially, Chinese were using chloroquine. There is the antiretroviral lopinavir. There is remdesivir that has also been tried. It was tried during Ebola. There is the issue of isolation of the antibodies. There are people trying vaccines, but everything is experimental. So that's a very key thing to say. So yes, we are also very delighted by the news coming, but it's still all experiment. It will still have to go through a lot of stages. Development of drug and vaccines, I think Daktari may be more vast there, takes at a minimum 2 years and sometimes up to 10 years.
Okay.
Yeah.
So even if they were to get a breakthrough, we have to wait for 18 to 24 months to be certain that this is working.
Yeah,
yes.
And even currently, I think globally, I think it's only in China and Australia where they are able to reproduce this corona virus, the genotype and all that. And it is, let's say, like from those places that you'll be expecting quite a bit of experiments to be done. And I think currently it is Australia that is a little bit much more advanced, and they are yet even to test it on animals before they move to the humans. But if you look at what they are giving here, you know, these are drugs that are already available in the market, and you can experiment here and there.
And then they work.
And you can see whether, whether it works or not. But the real, you know, vaccine production takes a bit of time. And then you must also look that pharmaceutical firms, a lot of them are not very keen in that area.
Developing. Is that what happened in 2002, 2004 during the SARS in China and MERS in Saudi Arabia? Because they dropped it, they began the research, and somehow they just stopped.
Yeah, but generally, if you look at the pharmaceutical industry, you know, they don't make a lot of money from vaccine production, because this will be a one-off thing. And yet, you know, the investment in terms of research is quite heavy. So unless the governments come in as a social responsibility, or certain foundations come in to support that, then they can be able to produce some of these vaccines. So it's not very encouraging for a lot of pharmaceutical firms, but because of social responsibility and everybody coming on board, I'm sure something can be done on this.
Oh, okay. Now I understand why the vaccine on SARS and MERS was dropped. Because if
but it's also difficult. The SARS, MERS, and now this SARS-CoV-2. They are the more dangerous or the more virulent viruses in the whole coronavirus family. But also they also change very fast, or what we call mutation.
So you might find one for this and tomorrow is
even
totally
just
different.
the flu that is caused by also an influenza, for example, we have a vaccine for it, but you have to take it every year because the virus changes so fast. So this coronavirus family, they also change so fast. In fact, some of the viruses that cause flu, the rhinoviruses, the adenoviruses, the immunity, even when you produce the antibody that you were talking about, only takes 9 days. So after 9 days, it's gone. You can still get another flu. So these also are challenges in the development of the vaccine.
Ken, some other good news, and this is not on the medical side, but perhaps this is a lesson, this is a global lesson on how we, as a world, come together to engage with pandemics. This perhaps is a crucial financial lesson as to how this can form one of the many economic shocks. I think when we were studying economics, this was rarely defined as one of the probable causes of a recession, but now you can see different countries having to come up with mitigation factors, but then also perhaps a lesson at community and coming together and fighting together. I think there's also been key lessons in how the world can do this. and then perhaps even some elements of disruption. Could this be the beginning of how we live differently, and how perhaps we even have more independent lives, able to work from home, able to be more efficient in how we do things? I think there's a silver lining in all these lessons we're able to learn.
And strengthening our healthcare.
Of course,
healthcare. I mentioned it right at the top. Time to rethink it.
Exactly.
I need to go to the cartoon of the week, because it's a little bit, we lighten our discussion. But what I wanted to ask, CureVac, the German company, what happened? Because we were told yesterday that Trump was offering some money for it to relocate their services, especially for fighting coronavirus, to the US. I don't think this is really, how do I say it? But it would be so unfortunate if he was to do it. Was it true that he was trying to buy them out?
I'm not very much privy to that, but...
it was news all over yesterday.
As I told you, the only ones that I knew of where serious experiments are being done is in China and Australia. This animal health laboratory cooperation. That's where they are quite a bit advanced. And I think they're the only two labs globally that can produce corona.
Because even CDC, what they did is that some of the drugs that are already approved, I think you mentioned the antiretrovirals, the CDC, which is the US body that does a lot of research, they jumped it to phase 3.
True, exactly.
So that's what they did. So they never started from the beginning.
They just went straight.
And I think also, Ken, before we get into the cartoon, it's important to note that China requires to be lauded for their efforts. China will actually be supporting the African CDC establishment, and have actually greatly resourced it. And tomorrow they'll be sharing a comprehensive from beginning to end of their experience. And so they're holding a global conference with about 20 African countries in
China or in the US?
It's going to be a global, should I say, teleconference.
Oh, teleconference.
Yes, and the Chinese scientists will actually now be releasing all their protocols.
We have Kenyans
for the country. Yes, so we do have Kenyans who will be participating.
Is that where you said the president will be?
No. This is a different. No, this is a different. Yes.
Okay.
Yes.
I read yesterday also that but 35 companies and academic institutions are involved in this, and about 4 are already experimenting on animals, like you mentioned. All right, let's lighten this. And the cartoon of the week, let's say it on our screens. Alternatives. I think this is very interesting, but it's real. This is how we should go. Okay, so let me begin, Dr. Luga. Which one catches your eye?
This hip bump.
We'll try it before I leave. Okay. But there's one behind me here, Daktari, if you want to say it's too far. That one catches your eye. But your general outlook of how this was represented.
Yeah, so I think what we've been doing is this elbow, at least for me.
Okay.
Yeah, the mercy you
I think the namaste is very calm and peaceful.
Okay.
Yes.
Here we did foot bump with Anita when she left Aga Khan. I didn't want to say to shake her hands. I did the foot. Dr. Otoma?
I think I'll go for the bow, because as we have said, the more you minimize any contact,
yes,
the better. So if we will just either wave or just both, or even, I think that should be cool enough.
Okay. So why you host the sidebar,
yes,
and you have discussed the handshake quite a bit. So why the word handshake alternative? why not the word greeting alternative?
Greeting alternative. Oh, nice. Or the last one, just keep your hands in your pocket.
Yeah.
Exactly.
Yeah.
Just keep your hands. It's caused us a lot of trouble, because right here I walk out of the Nation Center during the day and everyone wants to shake your hand.
Exactly.
And hey, boss.
Exactly.
And it helps also to work with the sanitizer, the small one in your pocket.
It does.
We met quite a number of people who do that.